I am Ranjit Kumar. Now I am studying BSc Cardiac Technology in SNS College of Allied Health Science, Coimbatore. SNS institution is the first institute to implement design thinking. Design thinking has 5 pillars. They are empathize, ideate, define, prototype, and evolve. Now I am going to tell about CLT. CLT means Center for Learning and Teaching. CLT is dedicated to inspire and support best practices in learning and teaching that promote engaged, effective, student-centered, and lifelong learning to provide quality education. Heart is made up of 4 chambers. 2 upper chambers known as left atrium and right atrium, and 2 lower chambers called the left and right ventricles. Heart is made up of 3 layers of tissue: endocardium, myocardium, and pericardium. Endocardium is the inner layer, myocardium is the middle layer, and pericardium is the outer layer. Heart is divided into 2 separate pumping systems, right side and left side. Right side receives oxygen poor blood, and left side receives oxygen rich blood. Cell of heart explained in this slide. How will you manage this situation, or what medication will you use? Heart block is a problem because heart surgery makes my body control your heart rate. Some medication is also called atrial rhythm.
The heart electrical signals are initiated in its natural pacemaker, the sinoatrial node or SA node, and travel through the atria to reach the atrioventricular node or AV node. The AV node is the gateway to the ventricles. The AV node passes the signals onto the bundle of His. This bundle is then divided into left and right bundle branches which conduct the impulses towards the apex of the heart. The signals are then passed onto fascicular branches and spread through millions of Purkinje fibers over the ventricular myocardium. Heart block is a group of diseases characterized by presence of an obstruction or a block in the heart electrical pathway. A block may slow down the conduction of electrical impulses or, in more severe cases, completely stop them. Heart blocks are classified by location where the blockage occurs. SA nodal block or SA block, blockage within the SA node. AV nodal block or AV block, blockage at the level of the AV node. Intrahizian block, blockage within the bundle of His. Bundle branch block, blockage within left or right bundle branches. Fascicular block, blockage within the fascicles. Of these, AV blocks are most clinically significant. In fact, very commonly the term heart block, if not specified otherwise, is used to describe AV blocks. In AV blocks, the electrical signals are slow to reach the ventricles or are completely interrupted before reaching the ventricles.
Assessments are: is heart block serious or dangerous? Who is at risk of having heart block? Can heart block be prevented? How does heart block affect my life? Classification are inserted in this slide. Heart block have 3 classification. First degree heart block, second degree heart block, third degree heart block. Then the second degree heart block have 2 types, type 1 and type 2. Complication. The complications of heart blocks are inserted in this slide. Then also there very rarely threatening includes heart failure, arrhythmia, heart attack, sudden cardiac arrest. Treatment are inserted in this slide. Pacemaker is the best procedure to treat third degree heart block.
Coronary angioplasty, also called as the percutaneous transluminal or balloon angioplasty, is a treatment procedure to restore the blood flow in the narrowed or blocked coronary arteries caused due to plaques or blood clots. Most coronary angioplasty procedures last between 30 minutes to 3 hours. Once the patient is admitted, his heart is monitored and is given an intravenous sedative to relax the body. A needle is inserted through the wrist into the radial artery. A guard wire is then passed through the needle and is guided through the arterial system up to the heart. A flexible catheter is slipped over the wire and threaded up to the heart. This is monitored using a continuous X-ray imaging device called fluoroscope. At this point, the guard wire is removed and the tip of catheter is positioned to enter the coronary artery. A special dye is injected which allows the fluoroscope to take X-ray images of the arterial interiors and help in identifying the position of the block. This is called angiogram. Once the blockage is identified, a flexible guard wire is inserted into the artery vessel, followed by a balloon-tipped catheter over this wire to position itself at the site of the blockage. Rapid inflation and deflation of the small balloon pushes the vessel wall out, re-establishing the flow of blood in the artery. After the blocked vessel is reopened, the deflated balloon catheter is withdrawn from the artery. The same treatment procedure is repeated in the case of multiple blockages. Most patients may also receive a coronary stent, which is a small tube made of wire mesh designed to keep the artery open once it has been treated. A collapsed stent is placed over the deflated balloon catheter as it is inserted into position. When the balloon is inflated, the stent expands and locks itself into place. The deflated balloon and catheter are withdrawn, leaving the stent behind to hold the artery open permanently. Post-treatment, a pressure bandage is applied over the radial artery to prevent bleeding. One will need to lie down for several hours, during which signs of bleeding or chest pain will be monitored. The patient may either be discharged on the same day or after an overnight stay at the hospital.